Did you know that some of the smallest, seemingly innocent changes in your body could be silent signals of something much bigger? Today, I'm sharing 8 early warning signs of cancer that you absolutely must not ignore. But here's the thing, not all of these signs mean you have cancer, so don't panic just yet. These signs can often have other, less serious causes. However, ignoring these symptoms or delaying action can be dangerous. That's why it's so important to stay informed. And here's the best part. Stick around until the end, because I'll be sharing 3 critical tips that not only help you reduce your cancer risk, but also improve your overall health. Trust me, you don't want to miss a single second of this video. Before we dive in, let me emphasize, these symptoms don't always mean you have cancer. They could be caused by something much less serious, but ignoring them isn't the answer. Always consult with your doctor or healthcare provider if you notice these signs. Early detection saves lives, and it's better to be safe than sorry. Before we dive into the signs, let's talk about why catching these early warning signals is so important. Cancer is a complex disease that develops when cells in the body grow uncontrollably. One of the challenges is that early stages of cancer can often go unnoticed because symptoms can be subtle. Unfortunately, this means that many cancers are diagnosed at later stages when they're harder to treat. But here's the good news. According to the American Cancer Society, early detection significantly improves treatment outcomes for many types of cancer. By recognizing the warning signs early and seeking medical advice, you give yourself the best chance of catching it before it progresses. Number 1. Unexplained weight loss. Let's start with one of the most common warning signs: sudden, unexplained weight loss. Dr. Wakas Tai, a renowned oncologist, explains that losing 10 pounds or more without trying can sometimes signal cancers like pancreatic, stomach, or lung cancer. Here's why. Cancer changes how your body processes energy. Tumors release substances that can affect your metabolism, causing unintentional weight loss. Of course, weight loss can also be due to stress, thyroid issues, or other conditions. But if this happens without clear reason, it's worth investigating. A key tip: keep a journal of your weight. Tracking trends over time can help you and your doctor identify patterns and address any issues early. Number 2. Persistent fatigue. Feeling exhausted all the time, even after a good night's sleep. The American Cancer Society points out that extreme fatigue that doesn't improve with rest can be a red flag for cancers, such as leukemia or colon cancer. This type of fatigue isn't your typical "I didn't get enough sleep" tiredness. It's often described as a deep, bone-crushing fatigue that makes even simple tasks feel overwhelming. In some cancers, this occurs because your body is working overtime to fight the disease, depleting your energy reserves. Number 3. Changes in bowel or bladder habits. Let's talk about changes in bowel or bladder habits. Dr. Elizabeth Common, a leading oncologist, stresses that persistent diarrhea, constipation, or even blood in your stool could be linked to colorectal cancer. Similarly, changes in urine frequency, color, or consistency could point to bladder cancer. For example, if you notice dark, red, or cloudy urine, or if you suddenly feel the need to urinate more frequently, these could be early signs of bladder issues, including cancer. A quick visit to your doctor can help determine if something more serious is going on. Number 4. Persistent pain. Pain is our body's way of telling us that something isn't right. Persistent pain, especially in the bones or back, could be an early sign of cancers, such as bone cancer, or cancers that have spread. The Mayo Clinic advises paying attention to pain that doesn't go away after a few weeks and isn't linked to an injury. For instance, chronic back pain could indicate pancreatic cancer, while ongoing headaches could point to a brain tumor. While most pain is due to non-cancerous causes, persistent or unusual pain should never be ignored. Number 5. Skin changes. Skin cancer is one of the most common cancers, and luckily it's also one of the easiest to spot, if you know what to look for. Changes in moles like uneven edges, different colors, or rapid growth can be signs of melanoma. The NHS recommends following the ABCDE rule: A for asymmetry, B for border irregularity, C for color changes, D for diameter, greater than 6 millimeters, E for evolving shape or size. If you notice any of these, Get it checked out immediately. Remember, early detection can prevent skin cancer from spreading. Number 6. Unusual bleeding or discharge. This is one of the most alarming signs. Dr. Ashwin Sharma explains that unusual bleeding, whether it's coughing up blood, blood in the stool, or urine, or abnormal vaginal bleeding, can indicate cancers like lung, colon, or cervical cancer. Even a small amount of blood that seems out of place is worth investigating. Don't dismiss it as a one-off event. Schedule a doctor's appointment and get it checked. Number 7. Lump or thickening under the skin. A lump or thickening in the breast, testicles, or lymph nodes is often one of the first noticeable signs of cancer. The CDC emphasizes the importance of regular self-examinations to detect changes early. Here's what you need to do. Gently feel around the area for anything unusual. If you notice a lump that wasn't there before, don't panic, but do make an appointment with your doctor to get it checked. Number 8. Difficulty swallowing. Lastly, difficulty swallowing can be linked to throat or esophageal cancer. If you feel like food is getting stuck or you experience pain while swallowing, this isn't something to ignore. Chronic heartburn or acid reflux can also contribute to these cancers over time, so managing those conditions is crucial. Now, as promised, here are 3 bonus tips to help you stay proactive about your health and reduce your risk of cancer. Tip number 1, prioritize regular checkups. Early detection is key. Regular screenings like mammograms, colonoscopies, and skin checks can catch cancer before it becomes life-threatening. Tip number 2, improve your diet. A diet rich in fruits, vegetables, whole grains, and lean protein can lower inflammation and reduce cancer risk. For example, cruciferous vegetables like broccoli and kale contain compounds that fight harmful free radicals. Tip number 3, quit smoking and limit alcohol. Tobacco and excessive alcohol consumption are 2 of the biggest risk factors for cancer. Quitting smoking and drinking in moderation can drastically improve your overall health. So there you have it, 8 early warning signs of cancer and 3 powerful tips to reduce your risk. Remember, awareness is your best defense. If you notice any of these signs, don't wait. Talk to your doctor immediately. If this video helped you, please give it a thumbs up, share it with someone who could benefit, and don't forget to subscribe for more health insights. Together, let's stay informed, proactive, and healthy. Thanks for watching, and take care of yourself.